My name is Sammy Margot and I'm a chartered physiotherapist. Today I'm going to talk to you about exercises for a herniated or a slipped disc. But first we need to understand a little bit about the anatomy of the spine and where the disc is. So this being the spine, this is the skull, this is the pelvis, and these are the vertebrae. The yellow things are nerves that are in between each one of the vertebrae. These are the discs, which are like washers in between each one of the vertebrae. What happens with a herniated disc is the disc material comes out a little bit and it puts pressure on the surrounding area. It can be just locally or on the nerve. If it's on the nerve, it may well cause pain down the leg, sciatica, into the buttock, into the back of the thigh or into the calf and even into the foot. So the main aim is to take the pressure off the nerve and help reduce the inflammation. So we're looking to give this area space so that it can breathe. So first I'm going to show you some positions of comfort that you can get into to help alleviate the pain from the herniated disc. Come and roll onto your tummy please, and if you can, lie on your tummy. If you do have this problem, you might not get into this position so easily, so lie yourself down flat, head down. So in so doing we're opening up the low back, and that will allow things to settle down, and this can help alleviate pain in this area, in the buttock, in the hamstring, in the calf and or in the foot. So the main aim is to take the pressure off this area. So lying in this position for a while can help settle down your symptoms. It's quite tricky to get into and out of, but it's a position worth doing. Moving on to the next position, can you come and lie on your side please? So lying on your side can sometimes help alleviate the discomfort. Again, you might not be able to move into that position that easily. So it's quite often your problem side is uppermost. Can you bend your knees a little bit more? Both of them please. So we're getting into a fetal position, which again gaps the area, and I'm placing a pillow between your knees, particularly for those of you that have an hourglass figure. So that can help settle things down and allow the spine to be in a more comfortable position. So just lying facing that way, okay? And if you're lying on the floor, you might want to put something underneath the side just to flatten the area. So sometimes lying in this position can help alleviate the pain, but it's for you to figure out whether this is helping alleviate the pain. And come and roll onto your back, please. So lying on your back, often putting a pillow, lie yourself down flat, under your knees, but what we often do, if this position is not quite giving you relief, it will give you relief because it's softening your low back, but we often build up pillows a little bit more, put more pillows underneath your knees. But for some people, we even put a chair on the bed or they lie on the floor, and by being in this position, that will help alleviate your low back, gap the area. So even lying on your back with your legs on a chair can help take the pressure off the area. So we're going to move on to exercises now. Can you just put your feet down? So again, the main aim is to just be very gentle exercises, just to help prevent any muscle atrophy and keep things moving. But if any of these give you pain or discomfort, you must stop. So the way to do it is just some gentle pelvic tilting. So if you feel my hand, squash my hand down whilst you're sucking your tummy muscles in. So again, you're gapping the joint, holding it there, starting to wake things up, because you often do get some muscle atrophy, the muscles switch themselves off. So we want to keep working things and relax. And again, squash down as hard as you can, but holding each one for 5 seconds. So you can do those 10 times, and obviously I won't be there. So if you want to have a go at putting your hand under your back yourself and just push down and holding it, holding it, holding it. And if you feel any pain or discomfort, stop and let it go. So that's a very good one to get going. You need to do 10 of those. The next one is buttock squeezing, and squeezing your buttocks. So squeezing your buttocks as hard as you can and relax. So none of this should give you any pain or discomfort. So you can do 10 of those, holding each one for 5 seconds. When you feel ready, it's very important to return to work or to activity as soon as possible, however moderate it is. So thinking about swimming or cycling or gentle walking, just some rhythmical exercises that won't aggravate you, that will just get you going, because the sooner you return, the better you'll be. But also it's very important that you have proper resolution, of your herniated disc so you don't get another reoccurrence. So a return to activity as soon as possible, respect the pain, but also look at things like weight. Weight's a big thing that can actually put a lot of strain on your discs, your posture at work, be it in the car, be it at your desk, your posture in bed, what position you're lying in, just making sure that your spine is well supported. And exercises, because we're leading sedentary lifestyles and you've got to keep strong, so making sure that you're taking breaks during the day at work, going for walks, keeping strong and keeping mobile.